The Americans with Disabilities Act is a civil rights law that prohibits discrimination on the basis of disability. One way the law does this is by requiring that businesses, organizations, even healthcare providers allow people with disabilities to bring their service animals into their offices. At the Northwest ADA Center, we get lots of questions about service animals. What is a service animal? How do I know if someone's dog really is a service animal? What am I required to do if a patient or a customer comes into my office with a service animal? So in this video, we're going to talk about some of those issues and clear up some of the confusion. The Americans with Disabilities Act has a very specific definition of service animals. Under the ADA, a service animal is a dog trained to perform a task directly related to someone's disability. Now let's break down this definition. The ADA only considers dogs to be service animals. Any other species of animal, even if it's trained, isn't considered a service animal, at least under this law. It's also important to know that service animals can be any size or any breed of dog. And this is important because different kinds of dogs can provide different kinds of services or supports to people with disabilities. Some people with disabilities might need a smaller service animal that they can carry close to their mouth, and that animal can sense and smell low or high blood sugar. For other people with disabilities, they might need a large service dog that can help them with navigation and support. Service animals can be trained to retrieve objects for people, including medicine or phones. Service animals can be trained to pull wheelchairs or help people with their mobility and stability. Service animals can also be trained to alert people to medical events like seizures or high or low blood sugar. They can also alert people who are deaf or hard of hearing to sounds in the environment. For some people with disabilities, a dog's presence can provide comfort and reduce the symptoms of their impairment. However, under the ADA, providing comfort or support in this way isn't considered a task, and emotional support animals aren't service animals under the ADA. A service animal must be trained to do a specific task related to someone's psychiatric disability. For example, they might bark or nudge someone to let them know that a panic attack is about to come on. They might lick someone to try and interrupt a panic attack. And they might also remove someone from a dangerous or unsafe situation so that they can calm down in a safe space. These are all tasks that a service animal can be trained to perform that support people with psychiatric disabilities. The ADA doesn't require service animals to be certified or registered. If you see companies or individuals online selling certification or registration for service animals, it's important to know that the Department of Justice doesn't recognize that. You can't request documentation that someone's service animal is registered or certified. Service animals also don't have to wear a vest or any kind of identification. They don't need to have a special harness either. The ADA requires healthcare providers to make reasonable modifications in their policies, practices, or procedures when necessary to accommodate people with disabilities. That means that healthcare providers that have a no pets policy generally must modify that policy to allow service animals into their facilities. Generally, service animals are allowed to be with their person even in places that don't allow pets. That means that service animals can accompany people with disabilities in all areas of the facility where the public is allowed to go. In the healthcare setting, this can include admissions and discharge offices, the emergency room, inpatient and outpatient rooms, examining and diagnostic rooms, clinics, rehabilitation therapy areas, the cafeteria and vending areas, the pharmacy and restrooms. Service animals are even allowed to ride with their person in an ambulance. If immunocompromised patients are able to receive visitors without using protective garments or equipment, an exclusion of service animals from this area would not be justified. In most settings, a service animal will not fundamentally alter the situation. But in some settings, a service dog could change the nature of the service. For example, it may be appropriate to keep a service animal out of an operating room or a burn unit where the animal's presence could compromise a sterile environment. But in general, service animals cannot be restricted from other areas of the hospital where patients or members of the public can go. You might be wondering, what if my staff can provide the same service or tasks that the service animal does? Do I have to allow the service animal in that situation? And the answer is yes. Service animals still need to be included, even if your staff can assist someone with mobility or monitor them for seizures. That's not a reason to exclude a service animal. The ADA also has requirements for people with disabilities and their service animals. A service animal must be under the control of its handler. Under the ADA, service animals must be harnessed, leashed, or tethered, unless someone's disability prevents using these devices, or these devices might interfere with the service animal's tasks. For example, someone's service dog could be trained to investigate spaces to make sure that the spaces are safe. And in that case, a leash or a harness would hamper the dog's ability to do its task. Under control also means that a service animal should not be allowed to bark repeatedly, especially in a quiet place. However, if a dog barks just once, or barks because someone has provoked it, that doesn't mean that the dog is out of control. Service animals also must be housebroken, but it's important to note that animals get sick too, and accidents occasionally happen. And in those circumstances, simple cleanup can address the incident. People with disabilities are responsible for caring for and supervising their service animals. Staff isn't required to provide care for or supervise someone's service animal. These include toileting, feeding, grooming, and veterinary care. If someone's service animal is out of control or not housebroken, you can ask them to remove their dog from the premises. However, you have to allow the person with the disability to re-enter without their service animal. There are occasions when a person with a disability might be in bed in a hospital for a long period of time. In such an instance, the individual might not be able to walk or feed their service animal. In that case, if the individual has a family member, a friend, or someone else who's willing to take on those responsibilities, the individual's obligation to care for and supervise the service animal would be satisfied. If the patient is unable to care for the dog and they can't arrange for someone else to care and supervise their service animal, a hospital may place the animal in a boarding facility until the patient is released. However, the hospital must give the patient an opportunity to make arrangements for the dog's care before taking such steps. A service animal may not be excluded based on assumptions or stereotypes about the animal's breed or how it might behave. However, if a particular service animal behaves in a way that poses a direct threat to the health or safety of others, that animal may be excluded. If an animal is excluded for such a reason, staff must still offer their services to the person without the animal present. When it's not obvious what service an animal provides, there are only two questions that your staff can ask. One, is the dog a service animal required because of a disability? And two, what work or task has the dog been trained to perform? Your staff can't ask about the person's disability, require medical documentation, or any kind of certification or training documentation for the dog, and your staff can't ask the dog to demonstrate its task. According to the Department of Justice, requiring documentation for service animals would be unnecessary, burdensome and contrary to the spirit and intent of the ADA. If you'd like to learn more about service animals, give us a call. You can also visit us at our website.